Hi everyone, welcome to another Facebook Live. My name is Zoe Clark. I'm Self-Management Program Officer here at NASS, and tonight I'm joined by Josh Poole, who's physiotherapist. Josh, do you want to say a little bit about yourself?
Yeah, good evening everyone. First of all, thank you Zoe for letting me join these sessions tonight. So my name's Josh. I am a qualified physiotherapist based in Colchester in Essex. I have worked in the healthcare profession for the best part of 10 years now, been qualified as a physiotherapist since 2015. I currently work in an acute NHS trust that has really, I feel, developed me as a clinician. And although it has been a very testing time of late, I still completely love exactly what I do. So specific to NASS, really, I began working in our local NASS branch around 2013 as an assistant whilst I trained for my physiotherapy qualification after being lured away by a very good friend of mine. And to be honest, it's probably one of the best decisions that I made in terms of my career. Not at all being influenced by being here with you all this evening, but NASS has been one of the best aspects of my career, as I've said, and love working within the team of all of the individuals who are part of our group. I'm sure all my colleagues across the country would agree with me on this. But yeah, that's a very small section about me.
That's really great to hear. And and thank you for everything you do for NASS as well, because I know you've got a demanding schedule, so it's great that you've got the time for all our AS patients. Brilliant. So tonight we're going to be talking a little bit about HIIT, which is high intensity interval training. And then Josh is going to lead a taster session on the exercise as well. Do you want to tell us a little bit about HIIT and why it's helpful for people with axial SPA?
Certainly. So high intensity interval training, or also known as HIIT, is a fantastic way of combining aspects of movement, strength, with a strong cardiovascular element to it as well. In essence, the training focuses on a period of increased activity or exercise levels. I know some people don't like the term exercise, so we'll stick to increasing activity. Obviously houses intermittent rest periods as well, so for your body to recover and your heart rate to reduce. So for example, and for the session that I'm doing this evening, it'll be 40 seconds of exercise with 20 seconds rest. This can, however, vary to the individual and their tolerance, and this is also one of the beautiful aspects of this type of exercise regime. If I was to be more scientific, the measurements would focus on about 80 to 95% of the estimated maximal heart rate, with the resting or recovery periods aimed at about 40 to 50% of that person's estimated maximal heart rates. To be even more scientific, a recent study, and I hope I say the gentleman's name right, Svayas et al., found that HIIT's workout regime specifically to patients with axial spondyloarthropathies or axial spondyloarthritis, it can actually help to reduce disease symptoms such as pain, fatigue, stiffness, and even inflammation in patients with axial SPA. Not only that, and also known with this form of regime, it improves overall function. So, you know, the day-to-day importance of activities of daily living improve. Your cardiovascular health, obviously, but I feel one of the most important things, and especially of late, is it boosts your positive mental health. You know, we're all quite restricted in what we can do at this current point in time, and being able to do sort of a short burst of activity within your own home environment makes it more applicable to everyone. I think, you know, helps give you what you need in a short period of time, so therefore also doesn't affect your day. It's very flexible to the individual. You can just complete it with body weight. You can use weights if you need, resistance bands. And like I said, it's not very time consuming. And you also then get provided benefits of the exercise for hours afterwards, including fat burning, improved blood flow around your muscles, oxygenation, all those sorts of factors. So yeah, that's a very brief example of what HIIT could do. But personally, as a physio, and obviously Zoe as a clinician as well as an osteopath, we're going to sell activity every single day. So anyway, I'll pass you back, Zoe.
Absolutely, thank you. That was really fascinating to get a look at it, both in terms of how people with axial SPA can feel afterwards and the benefits specifically for that, but also for overall fitness and for mental health as well. I think you're right, certainly, especially over the last few months. I think being stuck inside and not necessarily able to get out in the gym, it does have a really big effect. So something you can do in your own home, no specialist equipment if you don't have any, it's perfect, really.
Exactly that.
Brilliant. So I'll go through a little bit of the safety information as well for the session, because obviously it does involve a little bit of activity. So just want to make sure it's suitable for everyone taking part. So Josh is going to do one set of exercises and then he's going to repeat the same set again. Is that correct?
That's correct, yeah.
Perfect. So if you're new to HIIT, you can always watch the first session of exercises. And then if you think it's something you want to try, you can then join in with the second set. Alternatively, if you're not sure if it's suitable for you, you can always watch the video back at a later date, because it will stay on our Facebook page and go on our website and YouTube page as well. So do have a look. You can join in, ask your questions in the comments box. We can pose those to Josh at the end as well. And then you can always come back and do the exercise later on when you've got the all clear from your physio or from your doctor. If you do want to do the session, then it's good to have lots of space around you and just have a look around, make sure there's nothing that you could trip over, no hazards or anything. Wear some nice loose, comfortable clothing and good footwear as well. And then just have a bottle of water, maybe a towel nearby, just so you can have a drink and help you cool down a little bit if you need to. So hopefully that's covered everything. I think as well, having a chair, a good sturdy chair nearby will be helpful for any seated exercises, or also for balance if you need to as well. But as always, we just say, take it easy, do what feels comfortable for you, and just take rest breaks as you need as well, which I'm sure Josh will be saying through the session as well.
I hope so, yes.
Yeah. So yeah, we'll have a quick Q&A session at the end. But in the meantime, I'll leave it over to you, Josh.
Thank you very much. So before we begin, just to further add a little bit more advice, or actually what's going to be happening during the session. You've obviously been directed to do the warm-up if you want to partake. So that's one of the YouTube videos that myself and my brilliant team at NASS Colchester have developed and uploaded quite frequently for our group. It's suggested obviously that you do a warm-up prior to any activity to help reduce the risk of injury and other factors associated with that too. The way I'm structuring the regime, I'm going to be completing 2 5-minute rounds of exercise. For the first session, feel free to just watch, as Zoe just said, or join in. However, for the second one, I'd really like as many people as possible to try and join in if you can. The session will include 5 different exercises, which will last 40 seconds of activity with a 20-second rest period. Therefore, and if my maths is correct, that will equate to 5 minutes. Each exercise will be able to be completed in standing, or in standing with support, or sitting down. So please look at how you're able to complete the exercise that's suited to yourself, please. So this is what I've done with this regime here. So I'm really trying to, cater for all. But if you have any questions afterwards, or something doesn't feel right with yourself, or in terms of how you could progress it or reduce it, then these are the sort of questions that we'd want you to fire to Zoe. Controlled breathing is going to be an important element as well during that 20-second rest break. So please ensure that you're taking nice deep breaths in through the nose, filling up the base of your chest, and then obviously out through your mouth, okay? So I'm going to go through what the exercises are now very quickly, and then what I'll do is I'll start a timer on my watch, and I'll complete the 10 minutes in total consistently, if that's all right, just then I know what I'm doing. So I'm going to move my chair back and get myself all in position, so if you bear with me 1 second. So the first exercise you can either do in standing or in sitting is what I'm going to call climb the ladder. So you can either do it by like so for 40 seconds. And if you can see me on my chair, I'll just move the camera down a little bit. Sorry about this. Just so you can see what my feet are doing. Again, you can do this in seating like so. So that's what you do for the first 40 seconds and then 20-second rest period. The next exercise, one of my favourites, is going to be a sit to stand. So you can vary this to a level that you want to do, really. You can either do a sit to stand like so, making sure you're standing up nice and tall, shoulders up and back, chest forwards as well. Or what you can do is progress it into a shoulder press and a sit to stand based exercise. Okay, so arms down, bending and pressing up. Again, commencing that for 40 seconds. The next exercise will be a wall press. So you can either do this as long as you've got a strong supportive chair, or ideally against the wall, like so. So what you're doing is you're standing nice and tall, nice and straight, shoulders up and back. You're allowing your elbows to bend, and then you're pressing away. Again, completing this for 40 seconds. What you can do with your chair, you can place it up against the wall as well, for example. Again, sitting forwards, leaning and pushing back. The next exercise, which I'll probably do in seating, just so it's easy for me, okay, is going to be what we call a frontal raise. Bring your arms up to the side and down again. And then the way you do it on the way back is up from the side, coming forwards and down. And again, completing this for 40 seconds. Again, please take note of what my posture's saying, making sure your chest is sticking out, making sure your shoulders are up and back, and you're sitting with a really confident posture. And the final exercise, you can again either do in sitting or standing. I'll demonstrate in standing, is a gentle side bend. So what you're trying to do is reach down the side of your leg, holding for a second or two, coming back up to a neutral position, and then down to the side. Okay, and like so. You can use weights if you want, hold them in either hand, but for the purpose of this video, I'm just going to demonstrate you with body weight. Again, you can do it while sitting, so again, sitting up nice and tall, bend down gently. What's really, really important with all these exercises is that you're only working to what your levels are. You're not working anyway into the pain or any discomfort. You're working just before those points, so you feel a nice, comfortable stretch. So, with no further ado, what I'm going to do is I'm going to start the workout. I'm going to set my watch as well. So if you have a smart watch, if you want to partake in the second round of this, then please do. It's good to try and track to see what your activity levels are, potentially what your heart rate is, etc. And I'm going to give my timer at least another 25 seconds, just so I'm on an even number, and we'll go from there. I hope that was quite clear and concise. Any questions, please fire to Zoe, and obviously I can hopefully answer them at the end of this session. All right, so in 10 seconds, we're going to begin. Hopefully nice and loose and warmed up from the other videos that you would have checked out. All right, and we're going to start now. So, climbing the ladder, 40 seconds. If you're really keen and energetic, you can do it whilst running. But again, for the purpose of this video, just do it nice and gently, okay? You're progressing your movements as best as you can. Even if you're just up to this level, you could be punching forwards, you know, kind of make it your own. But the whole important aspect of this is to incorporate as much of your body as your body possibly can. Right, we've only got 10 seconds left. 5, 4, 3, 2, 1. Now, during this time, like I said, some nice deep breaths in, really expanding the base of your chest, oxygenating your body as best as you can, and breathing out. So therefore, you're controlling your heart rate and you're controlling your respiration too at the same time. Right, 5 seconds, then we're going to move on to the next exercise, which is the sit to stand. Right, and off we go. So either sit to stand like so, make sure you're pushing through your heels, you're standing up, pressing nice and tall, squeezing your leg muscles as you stand fully into extension. Okay, again, what you can do is you can progress this into a shoulder press exercise as well. So arms coming down by your side, pushing up. I'm getting out of breath already. Ten seconds left on the clock. Nearly there. Again, vary the exercise you can and stop. Right, okay, so deep breath again. You can make it a bit of an active rest, so just doing some little steps on the spot just to keep your momentum going throughout the whole process. Right, next exercise, wall press. So position nice and carefully, and off we go. So bend your elbows and gently pushing back. Keeping your back nice and straight. Please control the movement going down. Don't go down too sudden in case you hit your head. "20 seconds done. I hope you can see that the focus is working in all parts of the body at the current point in time. Right, 5 seconds. And rest there. Again, come back to your neutral position, some deep breaths, have a seat if you need to. Okay, and then we will commence on to the fourth exercise. Again, I'll demonstrate this in sitting just for the purpose of the video. 5 seconds left of rest. Up nice and tall, think about good, confident, strong posture. Right, so arms coming forwards, out to the side and down. Again, this is another nice exercise that you can do with weight if you feel comfortable too. They could be jars, they could be bottles of water, they could be resistance bands, or they could be dumbbells. They don't have to be heavy weights at all. It's not about that element of strength training, it's about building that endurance as well. Right, 10 seconds left of this exercise. And rest there. So, final rest break before we finish our final exercise of that set. I'll then give another 30 seconds before we commence the next session. So if you want to join in with that next session, then please feel or warm yourself up and get ready for that. Right. So the last exercise is side bends, okay? So bend down gently to the side, try and feel the outside of your leg. Slowly down, up to neutral, then back down the other side. Right, we're halfway. Ten seconds left of this last exercise. And rest there. Right. So what I'm going to do actually is we'll do probably about a minute's break, just so everyone feels ready to. We're going to run through, and I'm going to start again if I'm doing the exercise regime again. Okay. So we're going to go through the first exercise, which is climbing the ladder. So that's number one, which you do sitting. The second one is sit to stand. So the use of your chair, like so, like a squat, or like a press. The third exercise is the wall press. Okay, again, you can do that in sitting if you're leaning forwards against the table or against the wall, allowing your elbows to bend and pushing yourself back out again. Number four is working shoulders, up, out to side and down, up, out to side and back to the middle and down. And then the final exercise is the side bends again. Okay. Like I say, if you want to incorporate some lightweight, you can. Please make sure you've got a drink, you've got a towel with you. You're aware of your spatial, your surroundings, you've got good footwear on that supports you. But again, if anything comes to mind, if you want to start halfway through and send some questions to Zoe, then please do. Right. I'm going to start in the next 5 seconds, okay? I'm going to do most of these in standing. Right, so off we go, climbing the ladder. Exercise number one. Try and keep up with the momentum if you can. Work to the levels that you can work to. If that's uncomfortable for your shoulders, you could gently be punching forwards too, or even out to the side. Okay? 20 seconds down, keep going. Ten seconds left on the clock, keep going, not long left, then you can have a rest. 3, 2, 1, and rest. Right, deep breathing, in through the nose, out through the mouth, okay? Try and aim to get 3 or 4 of those breaths in if you can. And then we'll commence on to the next exercise, which is the sit to stand exercise. Right, and off we go. So either like so, standing nice and tall. As you stand tall, please make sure you're extending as best as you can, squeezing those bottom muscles when you're in this position. Slowly down and slowly all the way up. Just remember with all these exercises, the exercise is also on the way up and the way down, okay? Halfway, for anyone who wants to do the shoulder press with the exercise as well, please feel free to do so. Again, a nice one that you can incorporate weight to if you want to. 10 seconds left. 3, 2, 1, and rest. Deep breath again. Again, focus on the base of the chest when taking those nice deep breaths in, please, okay? Get yourself into position, ready for the next exercise, which is the wall press. Back nice and straight, arms supported, and off we go. So gently bend your elbows and pushing out. Bend your elbows and push up. Okay, nice and safe. Nearly halfway, keep going. Ten seconds left. Come on, last 5 seconds. Keep going all the way. 3, 2, 1, and rest. Right. Fourth exercise the frontal raises into what we call the lateral raises and back down again. Again, you can use weight if you want to. You can do this exercise in standing. Do what you feel is comfortable. Okay, 5 seconds, deep breath, and out. Right, arms going up, out to the side, back down. Up from the side, back to the front, and back down again. Think chest up and out, shoulders up and back, good posture. "15 seconds left. Keep going, guys. 3, 2, 1, and rest there. And then the final exercise is the side bends. So deep breaths in, keep the rest break fairly active if you can by doing some steps on the spot. And we'll finish the last one in the next 5 seconds. Right, ready? And off we go. Bending down to the side, holding for a second, back up, down the other side. This is a great exercise for opening up those facet joints in your spine, especially if you're feeling quite stiff. Please focus on that movement, slowly going down and up. Neutral point is really important in this exercise, then going back down to the side. All right, 15 seconds left. This might seem quite a simple exercise. If it is, this is where you could possibly incorporate a little bit of weight in each hand. 5 seconds left. 3, 2, 1, and rest there. So that's the exercise regime done. That's the 5 exercises. What you can do again, if you wanted to, is to obviously repeat them as many times as you feel possible or able to. Ideally, no more than 15, to be honest, to 20 minutes. So it's only 3 sets of exercise, and you've already increased your heart rate, and then you've got prolonged effects for at least up to about 6 hours plus. So yeah, I'm going to stop waffling on now, because that's what I tend to do, Zoe, and I'll pass back over to you if that's all right.
Of course, I'll let you get your breath back a bit. I've definitely got the easier end of this job this evening, haven't I?
Also, trying to multitask is quite difficult for me in any respect. So yeah.
No, that was excellent session. It was a really good variety of different exercises, working different parts of the body, and it was great the way you explained how, you know, you can change each exercise to make it, you know, a little bit more advanced if you want to, or particularly with shoulder mobility, a lot of people find reaching overhead difficult. So it was great that you sort of offered adaptations for that. So, you know, so many different people can benefit from it, really. So
brilliant, thank you.
Yeah. So we're having a few questions come through. We've got quite a few people watching and not talking, so I think that's a good sign that we've got lots of people joining in. We have my colleague Sally actually asked a question. She was asking if HIIT can lower inflammation levels in the body, if you know.
Certainly, well, from the study that I've read that I said about in my introduction, that's one of the importance. I believe it's a Scandinavian study that actually stated it did reduce inflammatory markers in the blood. I do need to delve a little bit more into detail in terms of what type of inflammatory products it could reduce, but you know, I mean, the science is there for itself. It also improved many of the important outcome measures that AXPAR look at as well, like the BASDAI and the ASDAS as well. So, I mean, yes, it's great to see that like there's a physiological change and improvement, which is important, but also the overriding benefits are more on the patient's mental health and function. And in respect, and this is something I try to sell to all my patients, regardless of the condition that they have, that if your body's in a fitter, more functional state, you know, you are there more resistant to things like infection, things like inflammation, etc., etc. And those flares, especially with AXPAR, you know, could potentially be reduced or, you know, very rare and few are far between, or maybe not have a significant impact. So yeah, so I have answered hopefully Sally's question in a roundabout way, but I will quite happily forward that study on to her, which I'm, to be honest, sure most of yourselves are probably already aware of anyway, but yes.
Absolutely, yeah, we can share that. We'll pop it in the video description tomorrow as well. So yeah, that was really helpful. I've got a question from Jill, who has bought some weights, and she wonders if there are any good YouTube sessions that you can recommend, which I think you can do a shameless plug here if you want.
I could do. So I don't know if anyone's aware, but we set up a YouTube channel, Culture Branch. This was, I should have restated this in the beginning, but this was a very much a significant team effort. I work with a wonderful array of physiotherapists and assistants, and also the patients that come along as well. I say that, I was going to say patient. I don't like the term patients because they don't feel like patients. They helped us all come up with this idea as we met prior to, unfortunately, COVID making significant impact to how we laid our sessions. And then, this is how we devised the more virtual aspect, which obviously everyone seems to be adopting. So please check out, so if you search on YouTube and put Colchester NASS in, it should come up. We should be the only one up there, hopefully, fingers crossed. I'm a bit of a fan of Joe Wicks. I find his sessions quite good. His levels are slightly higher to what I would consider be appropriate, and obviously don't have maybe potentially the same mindset that us as allied health professionals would consider when we understand the body in terms of a bit more of a medical context, I suppose. So it's just taking it with a pinch of salt, it's trying it. But all the exercise that you see, that you can make them specific to yourself. I hope what I demonstrated there can help you with that, Jill. You can add weights throughout all of those exercises I've just demonstrated. But the best thing is to try body weight first, I'd recommend, until you feel confident with the movements and the patterns, and then therefore I'll incorporate weight, and keep the weight really low as well. You'll notice the difference. You don't need to have heavy weight with that.
Absolutely. And I suppose for anyone watching who doesn't have weights, even just using like a tin of beans or something like that, so you're not even having to buy anything, you can try it out first before committing to anything.
Exactly. A jar of Dolmio, it's good. You can help with anyone who has any difficulties with grip.
Yeah, perfect. And we're getting some great comments through as well. Particularly Katie said that it's been really reassuring, and to understand that exercise doesn't have to be intense or scary to be beneficial. So that's really good. So hopefully we'll get lots of people joining in later on and visiting a YouTube page as well. We've got a couple of comments about knee and shoulder problems, but I think Sally has directed them to some information we've got on the website. Jason's asked, in terms of at the moment, with it being difficult to sort of reach any sort of physio sessions, would you recommend sort of the NASS branches for people who perhaps aren't able to get to their physio through the hospital?
I'm not biased to this, but yes, Jason, absolutely, 100%. One of the obviously the biggest supporting factors, and unfortunately we're seeing problems across the country with not having access to hydrotherapy pools. That is a significant intervention that really helps benefit our patients. I would really recommend doing your research and looking into that. There's a lot of amazing physios out there who may not be even associated with an NASS branch, but do have a speciality interest in axial spondyloarthropathies or arthritis. So do your research. But from a personal basis and slightly biased, I would say definitely check out the NASS website, look at the branches that are local to you, and please, obviously, if there's anything I can help with, I'm sure Zoe and everybody else can. Just get in contact.
Yeah, absolutely. Yeah, everyone can email me directly or give us a call on the helpline, and we can point you in the right direction too. Yeah, we've got lots of really positive comments coming through. Not too many specific questions, so I think you've been really good at explaining everything. And
because I tried to tire everyone out first, so they can type or.
That might just be it. Yeah. No, it's been a really great session, and for anyone who's just joining us now, the video is going to stay on the page. We'll pop it on the website and the YouTube page as well, so you can go back, you can watch the workout again, you can give it a go and try some of those different variations and using different weights and everything as well. Try it out and see how it works for you. We have got a very enthusiastic hello from someone called Katrina, so I don't know if that's someone from the branch.
I don't know that person at all. No, she's not the person that lured me into NASS in the first place. I have to hands down thank Kat for my involvement in this altogether, because she was the one that actually brought me into NASS. We both also went on a course with the A-Stretch team a couple of years ago, which was one of the best pieces of CBD I've done in years. And again, very fortunately that the our NASS members clubbed together as part of it to help support us being able to do that. So yeah, it's brilliant. Kat and the whole team, Amanda, Chris, absolutely amazing. We're very lucky with who we have. But again, I think it comes with it. If you want to be involved in it, you have to have certain characteristics and things, and naturally all work together very well. And there's very good social events too, including the members. So it's all great.
Absolutely, yeah. Fantastic. So yeah, thank you very much. I'll just have one last double check, see if we've got any more comments coming through, but I think hopefully we've covered everything there. And if anyone wants to get in contact with us, they can as well. Yes, we've covered things there. So I'll finish up. Is there anything else you wanted to add or anything? We covered everything.
Again, I'm biased with this, but with the periods that we're going through right now, and especially with the winter months, it is, I'll safely say that I get affected with seasonal affective disorder. Mental health does get plagued with these sorts of issues, especially in the current climate, what we're dealing with. Activity has always been not just exercise, but activity, and this includes things like walking, your fluid intake, the right level of nutrition as well is really, really vital to actually help make you feel better, not just physically, but also psychologically as well. So I would always stress that activity and exercise will generally give you significant benefits throughout. So like I say, if there's anything else that I can help support with, obviously speak to Zoe, but I'm more than happy to support any future sessions or any queries or comments that you may have. So, but just thank you very much for letting me join.
No, thank you. It's been really, really great evening. We'll definitely take you up on some future sessions. So
Brilliant.
Brilliant. So I'll finish the live stream there, but thank you everyone for joining and for getting involved in your questions as well. And hopefully you enjoy watching it back and giving it all a go. See you next time.